Tooth extraction in a horse presents us with a challenge. It requires excitation of a vertical force in a horizontal plane. 3 steps must be carried out in order to pull a tooth. Step 1. Detachment of the gingiva. Step 2. Breaking down of the periodontal ligament, i.e. loosening of the tooth in its socket, and Step 3. Removal of the tooth from its socket. To detach the gingiva, we use gingival separators. This one in the shape of a hollow blade, lateral medial. We have gingival separators for all directions, here another, lateral medial with a straight shape, and here an anterior-posterior version to enable gingival detachment all the way around the tooth. This is of primary importance to enable the tooth to be removed later in one piece. The next step is to loosen the tooth, for which we use a spreader. We insert the forceps into the proximal space, i.e. between the healthy and the diseased tooth behind the tooth. One then position the expanding jaws and press them slowly together, which forces the tooth in a rostral direction. This causes the Sharpie's fibers, which hold the tooth in the socket, to tear. The procedure is repeated by applying the spreader in the space in front of the diseased tooth. Again, the jaws are pressed together, so the Sharpie's fibers in the space in front of the tooth are detached. This causes a gradual loosening of the tooth. In order to loosen the tooth still further, we fix a pair of extraction forceps, like this one, to the molar to be removed. Movable gripper jaws enable optimal positions on any shape of molar. We attach the forceps to the tooth and move the tooth in different directions to further tear the Sharpie fibers in the tooth sockets. Once the tooth is sufficiently loosed, we try to pull vertically. For this we used an abutment, a fulcrum or hypomochlon, which is positioned on the healthy tooth in front of the diseased tooth. The forceps are attached and vertical force is applied using the abutment. Extraction of P2, the first molar tooth, is a special case. This tooth has an interproximal space caudally where the spreader can be applied so as to press the tooth forwards, but rostrally there is no interproximal space to apply the spreader. In this area we used the bayonet chisel to loosen the tooth. Bayonet chisels are available in various scoop sizes to suit the width of P2. This is a forceps for extraction of deciduous caps. This is a universal extraction forceps, which are particularly effective for extracting incisors. For the extraction of incisors we also follow the 3 principles. We detach the gingiva, we loosen the tooth in its socket by breaking down the periodontal ligament, and remove the loosened tooth with dental forceps. To loosen the incisors in its socket, we have a choice of various sized hollow chisels. First we start with a wide hollow chisel which corresponds to the width of the alveolus in order to damage as little tooth substance as possible. Finally we use fine hollow chisels to loosen the tooth in its sockets down to the root. The first step in incisor extraction is loosening the gingiva. For this we use the wolf tooth elevator with crossbar. After we have loosened the gingiva, we take a hollow chisel in the appropriate size, which should correspond approximately to the width of the opening of the alveolus. In this case it will be a size 12, and using a surgical mallet we drive this concave blade into the alveolus.